Good afternoon, everyone, and welcome to our panel discussion on understanding Alzheimer's and dementia, the caregiver's role. I'm Vidisha Rudra, Head of Marketing and Sales at Senior Helpers of Frisco, and I'm honored to be your moderator today. Caring for a loved one with Alzheimer's or dementia can be a challenging and emotional experience, but knowledge and support can make all the difference. Today, we have an incredible panel of experts who will help us navigate the complexities of this disease, the role of caregivers, and the resources available to support families along the way. So it's my pleasure to welcome our distinguished panelists. We have Courtney Ranger. She is the Director of Programs and Services for the Dallas and Northeast Texas chapter of the Alzheimer's Association. She has 15 years of experience in creating, implementing, and managing community health programs in a variety of settings. She holds a Master's of Public Health from UT Health Science Center at Houston. Next, we have Shonda Hendricks, who has been a medical social worker for the past 21 years, most of which she has spent working with the geriatric population. She has always had a passion for advocating for people who are affected by dementia and has been a certified trainer for the Second Wind Dreams Virtual Dementia Tour program. Shonda's most current position is serving as the administrator of Sparrow Hospice. Dejana Howell is a seasoned registered nurse with a Bachelor of Science in Nursing from the University of Texas at Arlington. With over 12 years of diverse clinical experience, she has built a strong foundation in trauma nursing, medical surgical nursing, post-acute cardiac care, and more than a decade in hospice and home health care. As the Director of Nursing at Sparrow Hospice, she leads with both clinical expertise and heartfelt compassion. Driven by a lifelong passion for helping others, her mission has always been to make things better, one patient, one family, and one team at a time. With those beautiful words, let us begin this session of Q&A. This is going to be recorded and shared on our website for those who are not able to join us live. We'll keep the discussion to about 30 minutes and will ensure to cover as much ground as possible. So I kindly ask my esteemed panelists to keep their responses concise. With that, let's dive in and start the conversation. Let's first try to understand the disease. Courtney, my question to you is, what are the key differences between Alzheimer's disease and other forms of dementia?
So this is actually one of the most common questions that we receive. Dementia isn't a single disease. It's an umbrella term that covers a wide range of specific medical conditions, including Alzheimer's. So all of the disorders that are grouped under the general term dementia are caused by abnormal brain changes that then trigger a decline in thinking skills, also known as cognitive abilities. And these changes are severe enough to impair daily life and independent function. They can also affect behavior, feelings, and relationships. So Alzheimer's disease is, like I said, the most common, and it accounts for 60 to 80% of all cases of dementia. It's related to the protein beta amyloid and the protein fragment tau, and they create these characteristic plaques and tangles on a microscopic level in the brain tissue, which is what we believe is responsible for the cell death and loss of brain tissue that we see with Alzheimer's disease. While Alzheimer's disease isn't a normal part of aging, the greatest known risk factor is actually increasing age. We also have other types of dementia, including vascular dementia, dementia with Lewy body, frontotemporal dementia, and more. And all of these are related to their own unique changes in the brain. Now, I do want to say that there are many other conditions that can cause symptoms of dementia, including some that are reversible. So if you're seeing any of these symptoms, it's important to see a physician quickly.
Thank you. So, what would be the most common early warning signs of Alzheimer's that caregivers should look out for?
Everyone experiences dementia and Alzheimer's a little bit differently, but we have a list of 10 key warning signs to be on the lookout for. I won't go through all 10, but you can find that full list at alz.org/10 signs. I want to note that it's possible for individuals to experience one or more of these signs in varying degrees, and it's not necessary to experience all of these warning signs to raise concern. So one of the ones we hear about all of the time is, hey, I keep losing my keys. Do I need to be concerned? Well, that depends. If you lose your keys, but you're able to retrace your steps and find them again, you likely don't need to be concerned about that. I think that happens to every single one of us. I know it happens to me. But what might actually raise concern is doing things like placing items in strange places. So let's think putting shoes in the refrigerator or the inability to retrace your steps. Other common warning signs to be on the lookout for include things like increasingly relying on memory aids, like those post-it notes, or family members for assistance with tasks that were previously handled with ease. We often hear about people who will describe an item instead of using the name. So that's a issue with words. So you might hear someone say the thing with wheels in the garage instead of car. Again, I would check out the whole list at alz.org/10 signs.
Thank you. What are some of the biggest myths surrounding Alzheimer's and what are the actual facts?
Yeah. So there are two really big ones. I think one of the biggest myths is that nothing can be done to help someone with Alzheimer's, which couldn't be further from the truth. While we don't yet have a cure, we now have two treatments that can actually change the progression of the disease. And there are many medications available that can help to alleviate symptoms. I can tell you now that researchers are hard at work all over the world looking for a cure and for new treatments. And the landscape of what's available has changed dramatically in the past few years. There are so many reasons for hope. The second myth that we hear about is that the person dealing with this disease, whether it's the individual living with it or their caregivers, has to go through it alone. There are so many resources out there to help people who are living with the disease, caregivers, and family members and loved ones. We actually have a free confidential 24/7 hotline at 800-272-3900, which connects callers with dementia experts and master's level clinicians who can answer your questions, help you find the support you need, or just be there to listen. I cannot emphasize how important this resource is enough. And you never have to go through this terrible disease alone. I think you're muted.
Thank you so much, Courtney, for those insights, and that will help our listeners understand more about Alzheimer's and dementia. I'll now progress into the questions regarding care needs. This is for you, Dejana. Could you explain to our audience how does Alzheimer's progress through its different stages, and what major changes occur at each stage?
Okay, as a nurse, I often explain that Alzheimer's progresses through three stages, each stage with distinct changes that go beyond simple memory loss. The early stage is what we consider mild dementia. It's just not forgetting names. It looks like poor judgment, missing subtle social cues, or taking longer to complete tasks, having difficulty balancing your checkbook. People often cover this up and think that it's just a simple mistake, or they think it's normal part of aging. In the middle stage, which we consider moderate dementia, this is the longest and most challenging stage. The person may forget their address or even what year it is. They might put milk in the pantry, become paranoid, or accuse loved ones of stealing. They may wander at night, or resist bathing, which we find very frequently. And it's not out of defiance, it's because they just don't recognize the need to do those things. At this point, we consider home hands-on care becomes essential. And then we have the late stage, which is like severe dementia, severe Alzheimer's. The body begins to shut down. They may forget how to chew or swallow, leading to, of course, weight loss and choking risk. Their reflexes fade, so they might not smile or smile less or stop responding to touch. Eventually, they become bedbound, and they become at risk for injuries, infections like sepsis, aspiration pneumonia. We see a lot urinary tract infections. Unfortunately, these are the three major stages of dementia, Alzheimer's.
Thank you. Yeah, so you mentioned about home care. What are the key benefits of providing home care for the seniors who have Alzheimer's, and how does it provide support both to the patient himself or herself, and their family?
Well, being in hospice, I see firsthand the benefits of home care. And it's not only to the individuals, but also to the family. Um, it's more about the whole well-being of the family and the patient. For individuals, you are being in a familiar, the family or the patient is in a familiar environment. It helps reduce agitation. It helps reduce confusion and risk of wandering. And these are common symptoms of dementia. The care plans are personalized to the patient's stage and unique needs, allowing us to maintain their dignity and, of course, comfort. We're able to monitor for several changes of behavior, appetite, or mobility, and that might go unnoticed in a larger setting. For the family, home care providers provide a much needed relief to family caregivers. It allows them to rest and be present as for their loved ones rather than a full-time caretaker, which is very important. We help create a safe environment. We manage medications, preventing falls, and ensuring consistent routine. And as you can tell, for Alzheimer's, the routine is very important. The families really, they gain a peace of mind knowing that there's skilled professional in the home that helps support their loved ones and their evolving care. In my experience, home care is truly a holistic, compassionate approach. You're preserving quality of life for the patient while easing the emotional burden and load on the family. It's really something that's paramount.
Yeah, thank you. A similar question to Courtney. What are some of the most common behavioral and psychological symptoms of dementia, and how can caregivers effectively manage them?
Yeah. So everyone will experience Alzheimer's a little bit differently, but we have some general advice for managing the changes that we see in communication and behavior. In terms of communication, it's important to give the person time to respond, and especially in those early phases, speak to them directly rather than to their caregiver or a family member. It's also important to take time to listen to them and express their thoughts, feelings, and needs. And as the disease progresses, you may want to engage in more one-on-one conversations in quiet places, speak slowly and clearly, and ask one question at a time. As we move into the late stage, it's important to approach the person from the front and identify yourself, and also to encourage nonverbal communication like pointing or gesturing. Most importantly, regardless of the stage of the disease, try to keep treating the person with dignity and respect at the forefront of your mind. In terms of managing behaviors, we always recommend to try avoid arguing with the person. And if you're noticing that something is causing some agitation or distress, pivot to a different activity. Finally, and this is a tough one, I know, with all of the stress that a caregiver is under, but it's really important to stay calm as best you can to help prevent things from escalating further. We have lots of tips broken out by stage on our website at alz.org/care. So I just want to make sure folks know about that resource for all of the details.
Thank you. Can you quickly say a few things about how does nutrition and physical activity help manage the symptoms?
Yeah, so physical activity and nutrition are so important. We've actually seen multiple studies that have shown the benefits of physical activities for individuals with mild cognitive impairment or Alzheimer's. Research is suggesting that mild to moderate physical activity may actually help delay or slow a decline in thinking skills, lower stress, and possibly even help improve symptoms of depression, and maybe even reduce the risk of falls, which is another big concern. Some evidence also suggests that exercise may directly benefit the brain cells by increasing blood and oxygen flow. Even stronger evidence suggests that exercise may protect brain health through its proven benefits to the cardiovascular system. Well, we don't have any evidence that would prove that a balanced diet will be an effective treatment to address symptoms of Alzheimer's. The best current evidence suggests that heart healthy eating patterns like the Mediterranean diet do help to protect the brain. So, a Mediterranean diet includes relatively little red meat and has a strong emphasis on whole grains, fruits, vegetables, fish and shellfish, and nuts, and then olive oil and other healthy fats.
Thank you. My next question is to Shonda. When does home health care become necessary, and how does it complement non-medical home care services with patients who have Alzheimer's?
Sure. I'm going to build a little bit off of what Deshna talked about before me. So, home care, in particular hospice, becomes necessary when an individual with Alzheimer's reaches advanced stages of the disease. And so when they reach advanced stages of the disease, there's often very noticeable decline in their physical health and their functional ability, such as significant weight loss, frequent infections, or difficulty swallowing. And you'll also see that in conjunction with a severe cognitive decline where the person is no longer able to communicate meaningfully or recognize their loved ones. As far as how hospice and home care work with non-skilled care, hospice care works in harmony with non-medical home care services by addressing medical and emotional needs while allowing the individual to remain in a familiar environment. While non-medical home care focuses on assistance with activities of daily living like bathing, dressing, and companionship, hospice offers a layer of clinical support in managing pain, providing medications, and ensuring comfort for that patient and the entire family.
Thank you. Dejana, I pivot back to you. When do you think it's time for families to consider hospice care for their loved one? And additionally, if you can add, what support does hospice care provide both for the patient as well as their caregivers?
Okay. So I often tell families it's time to consider hospice for a loved one with Alzheimer's when disease has progressed to a point where the quality of life is declining and comfort becomes the primary goal. Key signs include difficulty swallowing or significant weight loss, frequent infections like a UTI or pneumonia, needing total assistance with daily care, bathing, dressing, eating, no longer recognizing loved ones or engaging with their surroundings, sleeping most of the day, very limited communications. If your loved one is declining despite care and you're focusing more on comfort than cure, then hospice can provide support for your family needs. Medically, emotionally, and spiritually, they pretty much do it all. So, as a nurse, I've seen how hospice care provides powerful support for both the individual and the caregivers, especially during the final stages of Alzheimer's. For the individual, we focus on comfort and dignity, which is very important. We manage pain, shortness of breath, agitation, and other distressing symptoms. The care plan, of course, is always tailored and reviewed regularly by a full team, which includes the nurses, the aides, the chaplains, and of course, the social worker. We provide equipment, medications, supplies right at home, minimizing hospitalizations. For the caregiver and family, Families get 24 hours, 7 days a week on-call nurse access for guidance and, of course, peace of mind. Aides assist with personal care, easing the physical burden on the family. Social workers often offer emotional support, counseling, and help navigating difficult decisions. The chaplain provides spiritual comfort if desired, and of course, bereavement support continues even after the loss. Because, after the loss, it doesn't mean that everything is closed. We still continue to walk with you.
Shonda, the next question is to you. What should families expect emotionally and logistically when they transition a loved one from their home or from an assisted facility to hospice care?
Okay. So families should expect a wide range of emotions whenever they're transitioning their loved one to hospice care. And that can be grief, a little bit of relief sometimes, which is very normal, fear, or even guilt. And this shift means that they're focusing from curative treatment, which is what we're all geared toward, our entire life, to focusing on comfort and ensuring the dignity and quality of life for the time that remains for their loved one. So logistically, hospice brings a team, like Dejna alluded to, of nurses, aides, chaplains, and social workers like me. We help manage pain, provide emotional and spiritual support, and navigate practical needs, whether it's advanced directives, funeral planning, or helping navigate family dynamics that often pop up in end of life. Care can happen at home, in a facility, or wherever your loved one is most comfortable. So emotionally, the journey, as we know, is very, very unpredictable. Some days are filled with deep conversations and connections, and others are completely overwhelming. But the benefit you have is you have that ready built-in team to lean on, and we're not just there for the patient, but as we've said already, we're there for the family too. And we always, focus on we're not giving up hope. We're reframing that. And it's about making the most of the time that that person has left with their family.
Thank you. On similar lines, Courtney, I would like to ask you, what legal and financial preparations should family consider when they're caring for someone who has dementia or Alzheimer's?
Definitely. So legal, financial, and end-of-life planning is essential. And when it's possible, we actually recommend involving the person who's living with the disease in these conversations, which is another reason why early diagnosis is so important. Legal planning will typically include taking an inventory of any existing legal documents and then reviewing them and making any necessary updates, making legal plans for finances and property, putting plans in place for enacting future healthcare and long-term care preferences, and finally, naming another person to make decisions on behalf of the person living with the disease when they no longer can make those decisions. Financial planning should include an assessment of any assets and debts, family members that should be included in financial plans, and identifying costs of care and any benefits that may be able to assist, including government benefits, long-term care insurance policies, and veterans benefits, if that applies to you.
Thank you. What kind of community resources and educational programs are available to support the caregivers?
There are so many resources to support caregivers, and sometimes I think the hardest part is just finding them because you have so many things to choose from. The first one I want to highlight is our helpline once again. This is a free confidential service that can help caregivers find answers, guidance, and support. It's available in over 200 languages, and you can reach it 24/7, 365 at 1-800-272-3900. We also have an extensive list of educational programming through the Alzheimer's Association, including our caregiver-specific series called The Empowered Caregiver, as well as general information about the disease, an in-depth look at warning signs, and ways to lower your risk. These programs are available in person and online, either live or on demand through our website. We also offer over 30 support groups through our chapter, which again, you can join either in person or online to make it a little bit easier for caregivers to find a group that works for them. You can find all of our educational and support group information in your area at alz.org/CRF. And I would also strongly recommend looking into your local area agency on aging, which also has a wealth of resources available to assist caregivers.
Thank you. We were talking about hospice care with Shonda and Dejana. This is a question for Shonda. Could you also add a little bit on how families should emotionally prepare themselves for the final stages of Alzheimer's?
Obviously, very, very complex and very individualized to that person and family. But, overarching, you need to realize that you're going to feel a very wide range of emotions, grief, sadness, and again, relief at times. And all of those emotions are normal. And you need to allow yourself to feel those and process without any type of guilt. The second most important thing, you need to remember to focus on your connection with your loved one over their changes in cognition. So they may not recognize you, which is always, very hurtful and disheartening for families, but they can still feel your presence. So sometimes you have to focus on the comfort that your presence gives your loved one. Third, you need to lean on your support system. So hospice teams, social workers, grief counselors are here to help. Joining support groups and sharing information with people that have walked that road with you is the best type of support there can be. And lastly, but most important, you've got to give yourself grace. There's no perfect way to do this. There's no perfect way to say goodbye. You need to take it one day at a time and remember that you're making the best decision for your loved one in that moment with the information that you have.
So true. Can you elaborate on how hospice care professionals can help families navigate the grieving process?
Yeah, absolutely. So as hospice professionals, we understand that grief is a deeply personal journey, and our role is to provide support before, during, and after a loved one's passing. So we help families navigate the process by offering emotional support, education, and resources that are tailored to the family's unique needs. So we do that a few different ways. First, we make sure that we create a safe place for open conversation. We always tell patients and families it's much easier to have open conversation about how they're feeling about the situation with our team versus their family because they don't care about our feelings. So it's easier for them to be open and honest with us. After loss, like Dejana's alluded to, we continue to walk beside them. We offer bereavement services for 13 months after someone's passing. That includes counseling, support groups, referrals to community resources. And we help remind people that their grief process is not linear and it's okay for them to travel that road at whatever speed and direction that they need to.
Thank you. Yeah, and I can personally relate to that. After losing my mother-in-law, the grief comes at unexpected times. Yeah, so thank you for sharing that. Thank you, everyone, for such wonderful advice and tips. One final question to each one of you, and I'll start with Dejana. What advice would you give to someone who has just become a caregiver for a person with Alzheimer's?
Okay. My advice for new Alzheimer's caregivers is you don't have to do it alone. That's probably the first and most important thing you need to understand. Learn about the disease process, learn what to expect. It's not just memory loss, it's changes in mood, judgment, language, and eventually physical function. Establish a daily routine. Structure helps reduce anxiety for you and, of course, the family member. Keep instructions simple and be patient. You're going to need patience. If your loved one becomes agitated or confused, redirect them gently rather than correct. in a rush. Their reality may not match yours, and that's okay. Take care of yourself. Probably one of the most important things you'll learn. 2, join a support group, ask for help, and take breaks when you can. Burnout is real, and caring for yourself helps you take care of others. And lastly, don't wait to plan ahead. Talk about legal, medical, and end of life wishes early while you still can. You'll thank yourself that you did it with now instead of later.
Thank you. Courtney, can you add your final advice?
I think I really echo a lot of what Dejana just shared. You don't have to go through this alone, so don't be afraid to reach out for help. Whether it's our helpline, finding a support group, or just some education or other resources, please just reach out and reach out as early as you can. Shonda mentioned giving yourself grace earlier, and I would emphasize that as well. In addition to being sure to try to find time to care for yourself, even if it's just a few minutes, you can do this, and you have an army of people who can help you.
Shonda?
Hey, you're going to hear the same thing 3 times, so we must be right. The advice I would give is that caring for someone with Alzheimer's is a journey that requires patience, flexibility, and self-care. Arm yourself with knowledge and educate yourself about the disease, because what that helps to do is to help you respond with empathy instead of frustration with your loved one. Again, routine and consistency is key, because that helps provide comfort to your loved one as their role becomes increasingly confusing for them.
Thank you. Thank you, everyone. As we wrap up today's discussion, I want to extend my heartfelt thanks to our panelists, Courtney, Dejana, and Shonda, for sharing their expertise and valuable perspectives. Your insights have provided much needed guidance for families navigating the challenges of Alzheimer's and dementia care. To all the family members and caregivers listening today, please remember, you are not alone. There are resources, communities, and professionals ready to support you on this journey. Whether it's through home care, hospice support, or educational programs, help is available. Finally, I encourage everyone to stay informed, seek support, and take care of themselves while caring for their loved ones. If you have any further questions or need additional resources, please don't hesitate to reach out to any one of us. Thank you all for joining us today, and we hope to continue these important conversations in the future. Stay well and take care. Goodbye. Thank you, everyone.